Over the past 40 or 50 years, we've seen a steady increase in obesity or overweight in our young people. And this translates into being overweight or obese as adults. And then this leads to a lot of unfortunate health consequences.
Parents have 2 jobs, 3 jobs, and there isn't anyone maybe to guide them to making healthy choices. It's much easier to go to the gas station, a convenience store, to grab a bag of chips and a pop instead of an apple and a milk.
You have a McDonald's just about on every corner, Burger King's, Pizza Huts, Little Caesars, $5 pizzas. You're talking about students who are exposed to just everything meaning junk.
That a lot of our students, as the years have gone by, are becoming more obese. They're less active. To get them to do any type of activity is a strain. A lot of our kids would rather sit on the sidelines than participate.
And so we've seen a society move from more activity to more sedentary, and from more nutritional choice to less healthy nutritional choice. And the consequence is ravaging our nation, and particularly our young people. So that is the need that we're trying to address in some way with our program entitled Project Healthy Schools.
This program comes in at an age when students start making decisions about what they're going to eat and what they're going to participate in, and it lets them know that these decisions have an impact on down the road.
Say you eat a heavier, higher fat diet, it's going to be harder for the blood to get through this tinier space, right? You're going to have to work harder. So say you keep doing that, and that's when you get a heart attack, exactly.
I don't really want to live a diseased life. I want to live a disease-free life.
We focus on 5 goals for every child. Try to exercise at least 150 minutes a week. Spend less time in front of a screen. Eat more fruits and vegetables. Drink less high sugar containing beverages. And try to eat less fast, fatty food.
In the 6th grade, it's a packaged curriculum. It takes 10 weeks, and it brings in different foods, different physical activities, different health information. The lessons are really geared towards capturing attention of 6th graders.
My lesson plan's already done for me. All the materials are always supplied, and there's always exercise or physical activity to every lesson.
Project Healthy Schools started beach volleyball about 5 years ago. It's a much anticipated event here. All students are involved.
Project Healthy Schools has been integral in starting the UPSM Student Garden and Salad Bar.
We work with the cafeterias to make healthier choices available.
We had classes grow lettuce that we then incorporated into the salad bar.
We try to get poor nutritional value beverages out of the vending machines. And we work in the classes to try to promote childhood health messages.
As a wellness champion, my role is to make sure that healthy choices are involved in our school store and our concession stands, just creating a healthy environment at the school. So the program remains sustainable even after PHS staff transition to a new school.
We don't accommodate every child with physical education. I would say 55% of our kids get gym. We could not afford to get our students more opportunities to be active.
We've worked with the YMCA to get grants to actually bus children from school to the Y.
Our students go over there and they participate in baseball, basketball, tennis, swimming, yoga, Pilates. Project Healthy Schools facilitated that whole endeavor. And I thought that was huge because, number one, they didn't have to do it.
We're using physiologic measures along with surveys to gauge what's working and what may not be working. We see significant drops in their cholesterol. We see small but real differences in blood pressure. We're seeing differences before and after we implement the program, and we see differences that are sustained over 3 or 4 years.
The parents are like, oh, you're why I can't fry chicken anymore, or that's why we have to read the labels now.
Our students have seen the results of eating healthy, have seen the results of having physical activity.
It's part of our school culture, and so I think that it just becomes a habit that they form.
They feel that they are empowered and that they're making good choices for their body.
All of this would not have been possible without the generosity of the health system as well as private donors and foundations. And I'm excited that the University Health System and all of our partners are working in one small way to take on the problem, one child at a time.